We'll start here in just a minute. Okay, I think we're going to go ahead and get started. We are here once again for our weekly news conference with Indiana University Health, Indiana University, the Monroe County, and the city of Bloomington to talk about response to COVID-19. As usual, our lineup is the same. I am Indiana University Director of Media Relations, Chuck Carney. We will be joined by Bloomington Mayor John Hamilton, Monroe County Commissioner Julie Thomas, IU Health South Central Regional President Brian Shockney, Monroe County Health Department Administrator Penny Caudle, and Monroe County Emergency Management Director Allison Moore, as well as IU Assistant Vice President for Strategic Partnerships, Kirk White. And I have not seen the mayor step in yet, so let's skip in the order. We'll go to Julie Thomas to start off with.
Great. Thank you, Chuck, and thanks everyone for being here today. So a few updates. Some of these we've gone over before, but county parks and trails are open with a few limitations. While most playgrounds are open, the splash pad is closed. A limited number of restrooms are open, but the drinking fountains are closed. Our meetings of boards and commissions for Monroe County have resumed via Zoom, and the agendas and links can be found at the calendar at co.monroe.in.us. County buildings are open to the public by appointment only. You will be required to wear a face covering. We can provide that for you if needed. Please contact the department through email or phone, and their information on each department's contact is available on the county website, of course. Food and beverage grants have been made to 30 county entities, totaling $299,467. The last call for grant applications is today at 5 p.m. Please go to co.monroe.in.us if you have not yet applied or you need to apply for additional funds. It's very important that that happens. I'm also really pleased to announce that on Tuesday, the Monroe County Council gave their final approval. We've been working with on some assistance for township or area residents. Townships cover the entire county. And we have worked with the township trustees to come up with a system, and we have worked with the council, and $100,000 will be available in funding for those who need assistance with things like rent and utilities. We do have, I'm proud to say, a decal that we're working on, and that is at the printers. We're very proud of this, worked with the health department on this, for area businesses who would like to have one. And we invite, sorry for the low tech, but we will be releasing details soon on how to get yours. These will be static decals for store, restaurant, shop windows. A couple of thanks first to everyone who donated blood this week at the Monroe County Convention Center. Allison Moore is going to give you some information on a few additional dates. which are already filling up. So that's really good news, and we so appreciate everyone in the community who has stepped up. And also thank you to everyone in the community who is wearing their face covering while out in public. This is a sign of respect and caring for your community, and it's making a big difference, and we all need to be participating. So thank you to everyone for that. And with that, we'll wait any questions. Thanks so much.
Okay, thank you very much. Mayor Hamilton has joined us on the phone, and Penny Givens, you'll be glad to know, he also had trouble with the login. So don't know what's going on there, but we'll go to the mayor.
Thank you, Chuck, and everyone. Can you hear me all right?
Yes.
Okay, great. I appreciate. Sorry, I don't know why the login didn't work, but the phone's back up. I'll just report. We, of course, continuing stage 4 and in terms of the opening and continuing to follow the science and the data. The local numbers continue to be positive overall, though a recent rise in cases and deaths in the county do demand our attention and following. I will report, it was in the paper, we had our 3rd employee test positive for COVID-19 after we had 12 weeks with 0 positives, and we do await several more tests for employees, and we're isolating and following the CDC guidelines for that firefighter and there are others who are in contact, and we think of them and their families and hope for the best. Very importantly, and I want to say very clearly, we need to recognize that signs around the nation are very concerning. Several states that have recently opened up have seen serious surges, such that we now have the highest 7-day national case average yet. We also have the highest single-day case just occurred, I believe, yesterday in the country, though deaths thankfully have not been as high. It's really important to note that some states and localities are actually moving backward to protect against the surge. As an example, just today in Texas, all bars that get most of their revenue from alcohol are under an emergency closure effective at noon from the governor. Florida, this was from a tweet, but reported, Florida just tweeted they are halting all on-site sale of alcohol at all bars. Madison, Wisconsin is diverting from their state's approach with a 10-person social gathering limit and requiring only seated presence at bars in Madison, Wisconsin. And we've seen, as they saw through contract tracing, a big surge in infections from young people socializing in those ways. Similar warning stories from Iowa City. We are not immune from the pandemic second wave or extended first wave, particularly as we expect tens of thousands of university students to arrive in the coming weeks, and also thousands of local students referring to their K-12 schools at a similar time. I'm going to continue to urge that we take the common sense steps needed to do what we can to avoid any local resurgence with the serious health and economic damage that would result. This means continuing to consider our local mask policy and to consider controls on potential super spreader events and locations, particularly large, indoor, non-physically distanced, long-lasting gatherings, such as can happen at bars or major social events. I'll close with, I do want to salute our incredibly dedicated local health professionals and all those who are protecting us against the virus. They are heroes working every day on these issues, some of whom are on this call. But we also need to recognize that Indiana's public health system is woefully underfunded, among the worst funded in the nation, and we need to be extra careful that we not add stress to our system. I believe we have to very carefully evaluate our local conditions and all our options before moving any further along the stages of relaxing restrictions and risking a greater virus spread in the coming weeks. And I'll be happy to take questions. Thanks.
Okay, thank you, Mayor. Let's go to Brian Shockney from IU Health.
Thank you, Chuck. Thank you for everyone who is on the call and the press and everyone who is here. You've been with us each week for several weeks, and we certainly appreciate your connection with us. This gives us an opportunity to share our wins and our concerns as we go forward. And so thank you. And thank you, Chuck, again, for your work. I do want to thank the community. If just released was the Fairbanks School of Public Health, their surveys that they did and the research that they did. The one that is really shows that we're doing a good job is that we are now at 0.6 of 1% in our infection rate through their last study, down from 1.7, which is good. But as the mayor said, we cannot let our guard down. We need to be sure that we are doing the things that we need to do, wearing masks, social distancing, not getting in large gatherings. When the release after the July 4th here of restrictions, and when it goes into place, we need to still keep in mind our personal protection and personal protection of others. I'd like to also thank those who have donated to our healthcare workers over the past several months. We've been able to recognize them in different ways in social media, but our team members have been overwhelmed and continue to be overwhelmed by the support, whether it's young children sending colored pictures to us and letters, as part of their schoolwork or not part of their schoolwork, or just restaurants who have reached out to us, some that have been very consistent in their giving to our healthcare workers. It is so much appreciated, and that means so much to all of us. So thank you for that. And I want to be sure that we recognize our restaurants and bakeries and those that have really stepped up for our healthcare workers, not only in Bloomington, but across the region, the South Central region. Our visitor restrictions continue to be where they are as we relax them a little bit. We are allowing one visitor to inpatient units with one patient, supervised, escorted to the location and back, wearing proper PPE, and also the same with our clinics as well as our surgery, outpatient surgery. We don't have plans to relax those any further at this time. We will continue to see how our numbers go across our region, also across our state, and continue to be careful. I want to be sure that if anyone has any questions regarding visitor restrictions, that they contact us. They can either contact our Facebook post and post there, or they can send an email to us and we will certainly answer their questions and concerns. But we know that visitors and family members are very important to the quality of care that we provide. They oftentimes know the story and know if our patients are in a state that they're normally in, or if this is a different behavior or action or a health issue than previously. So knowing that's important, we are wanting to be sure that they are available and at the bedside, but we are restricting those still to only one person at the bedside, and then we give exceptions as necessary. With that, I just want to be sure that everyone knows that we are open for business in all locations. We have all of our safety measures in place and cleaning measures. You are safer at a healthcare provider in your community than you are at a public gathering or a grocery store or somewhere else. And so continue to seek care when you need it. Please do not put off necessary care and further harm your health and wellness. So with that, I'll take any questions after we're done.
Okay, let's go to Penny Caudle.
Good afternoon. Thank you as well, Chuck, for putting up with us again this week. We appreciate you managing us, and you do a great job at it. Couple of things I wanted to just really start with have to do with some comments or questions that have come in this week, and I thought that they were good opportunities to just share a little more about them. You know, I had a conversation with somebody talking about illnesses with COVID and the deaths, and that we tend to talk about two things happening. We either talk about people who are hospitalized and hopefully recover, but also the deaths, or we talk about, for instance, young people don't tend to get as sick and, this is mild and people get over it. And the group that we often don't talk about are those people who feel miserable and are very sick, but not necessarily sick enough to be in the hospital. And that there's a wide range of symptoms that people may experience through this. And perhaps that is part of why people feel like if I'm not hospitalized, if I'm not among the group that tends to see really severe illness, that I don't have to worry about it. And so maybe talking about that wide range of illness that we see with this is worth mentioning. And so I do appreciate the person who I talked with about that today, and just wanted to kind of share as a reminder that, yes, there are some people who are asymptomatic. There are some people who have very mild symptoms. And that's what, if somebody's going to be infected, that's what we would wish upon all of them. But there's a wide range of illness, and not everybody recovers just easily or quickly from this infection. And that does make and serve as a good reminder for why we need to continue the precautions that we take. And several people before have even mentioned again why we do the things that we do. And we want to protect ourselves, but we want to protect the people around us as well. And even if I may not get very sick, I may take that infection to my mother or to a family member or a friend's parent, and they may not fare as well. So a reminder to keep those things in mind as we move forward. I think that people are, looking toward next week and the new governor's order and the new health order locally. We do anticipate some forward movement. That's what we would like to see. And based on the numbers right now, that looks like that is possible. But we certainly know that we have been moving slower than the state, and we've done that for reasons that, we're kind of talking about today. We were on Noon Edition earlier and talking with Shandy from IU, the School Fairbanks School of Public Health, and talking about many of these states didn't phase in the way Indiana did. They just opened up. And phasing in, I think, has been part of what has been good for Indiana. Whether or not we personally feel like Indiana has kind of taken it slow enough or not, that phasing in is a good thing. So we do anticipate we will still keep our gathering size lower than the state. We'll still keep that limitation at the bar. Those things we anticipate keeping, and we will look at where we are early next week before we make a final decision on things. As well as we have to wait to see what the governor is going to do. Part of that governor's order will impact our local order, and we don't get that information early or ahead of time. So we'll listen to that the same way that you will, and then we'll make any adjustments that we need to make from that point. So Dr. Sharp did want me to share that. Those are anticipations. We agree that we want to move forward. We want to move forward strategically and methodically so that we don't have to pull back drastically. But if we need to, we will. And it is up to all of us to take that personal responsibility so that we don't have to do that. So a few things. I know that the whole, with everything that's going on in the country, there is lots more talk about face coverings and requirements. And that's certainly something we've talked about, and certainly something we will continue to talk about. Our numbers right now are showing that we're in a good place, but that doesn't mean that that won't change. And we do have to think about what happens in August when our population grows and when we have more people in closer contact with one another. So those things are being discussed, but I would just sort of say these few things. Doing the right thing is about caring for yourself and others. So wear the face covering. setting a good example for your children, your grandchildren, your colleagues. Wear the face covering. And we have to be realistic that that's not the only precaution that we need to take. We need to wash our hands frequently, not touch our face, stay home if we're sick, monitor for symptoms, keep that 6-foot distance between us and other people, and wear the face covering when we can't do those things. It's very important. It's a combination of all of those things. Every business can require face coverings, and we know that many of them are. And that's one of the reasons that we put together those clings, and we're glad to have those available for businesses that want to use them. Yes, they could be mandated. They may be mandated in the future, and that's a decision yet to be made. We would prefer that people do the right thing and that they take personal responsibility for themselves and others. There were two things that I heard this week, just in the past couple of days, that I wanted to share because I think even if you don't agree with both of them, one of them may resonate with you. We had staff that did a presentation this week, and during that presentation, one of the people said that wearing a face covering is really very patriotic, that loving your country is loving the individuals in your country. And so the patriotic thing to do is to wear the face covering and protect your fellow Americans. And another one was a video that I watched, and the takeaway was, we will get through this with a mentality of we, not me. And so again, wear the face coverings, maintain that physical distance. When you are around people outside of your household, maintain that distance, wash your hands, clean, frequently touched surfaces, do all of those things that we've been talking about. And together, we can hopefully keep the spread of this infection down. Thank you.
Okay, thank you, Penny. Next to Monroe County Emergency Management Director, Allison Moore.
Thanks, Chuck. I too had some difficulties getting on with the Zoom call today, so I have also called in and wanted to make sure you can hear me loud and clear.
We can indeed.
Perfect. I wanted to announce that we did, as Commissioner Thomas spoke of earlier on the call, had a very successful blood drive, and wanted to thank those individuals in our community that made that donation earlier this week. We have 2 additional blood drives scheduled at the Monroe County Convention Center. You register the same as you did for the first one, and that is through the redcross.org website. Once you get to that website, there'll be a place to put a zip code, and you can put your Monroe County zip code in, and then it will list the Monroe County Convention Center. Those 2 dates are June 30th and July 17th. There is only a couple spots still open for June 30th. So if that's a time that works for you, you should probably hop on fairly quickly to get that available spot or a couple available spots. And then July 17th still has several spots still open. So I would encourage you, if that's something you can make a donation for, to go on and get registered for those. And that information is on the county website as well at co.monroe.in.us. Again, June 30th and July 17th. We continue to work with all of our school systems, public and private, to ensure that they have supplies and PPE for this fall and their re-entry plans, and have everything in place for those plans to ensure that all that supplies are available and needed. And we will continue to work with those schools between now and the fall, ensuring that they have all of those items from our office. And lastly, I just wanted to announce early on, we were collecting the homemade masks. We had various places in the community as a collection site, and then we were a hub at our office, as well as the health department, to distribute those homemade cloth masks. And as COVID continued, we started getting supplies and various things, and it wasn't necessarily as needed. And so we stopped making those announcements, continued to collect if those individuals did drop off. But I wanted to re-announce as we start to just prepare in case we do in fact have a second wave, or in case our numbers do start to increase in the state of Indiana, so that we could be best prepared to shuffle those masks out to various places that serve our public, and make sure that those individuals that need those masks, so that we would have them readily available. So if you are someone at home and could start sewing again, had a nice little break, and would like to step up again, we are going to start that mask collection again. It will be at the same site that we had previously. Those sites are listed on our website. Again, that website is co.monroe.in.us, and then you can find the emergency management page through that website, and then those addresses will be listed. And I encourage you, if you can, to make that donation, and we will see fit that it goes to a good cause. Thank you so much, Chuck. I'll be around for questions.
Okay, thanks. And then to Kirk White from IU.
Hey, good afternoon, everybody. Thanks for joining us today. At Indiana University, we're continuing in our phased and very guarded approach to restarting the campus at all of our locations around the state. This week, we're still in phase 1, but phase 2 starts next week. The campus will be open with limited access to some buildings. We will continue to ask our faculty and staff to work remotely if possible, and limit visits to the campus. Some employees will be called back as needed. Visitors to the campus will still be limited through July to outdoor visits only, unless it's an approved event and complying with public health guidance. And events and conferences are continued to be canceled through the month of July. So we continue as well in the big planning stages to get back open again in mid-August. There are several committees still working diligently on that. And we, as I mentioned last week, released our community responsibility agreement. And to date, 9,000 of our faculty and staff have signed that system-wide throughout our locations throughout the state. So I think there's been good acceptance, even considering it's the summer, that our university community is embracing the protocols. And that's very encouraging. We've not asked students to do that yet because there are no students on campus yet, but we will have that ready to go here shortly for our students to acknowledge as well. So planning continues, and we hope that that all will continue to act responsibly, and we can get back to our teaching, research, and service missions as soon as we can. Thank you.
Okay, happy to start taking questions from media here, either online or on the comments. I actually don't have one at the moment, but I'm going to jump back to Mayor Hamilton because you alluded to this, and we can see you now, that the actions being taken in other cities and states as a result of the resurgence of wave 1 here, how closely are you monitoring what's happening there and thinking about, okay, what do we have to do here, and thinking about what to do with businesses, particularly as we start to see more people come back to this community?
Yes, thanks, Chuck. And glad to be visual now, so sorry to be getting on. You know, every community is different. Our health officials know that. We've made that clear as we work to do the right thing here in our state, and every state is different. But there are some common issues and questions, and we're working very closely. I'm in touch, as I know some others are on this call, with some of the cities around Indiana, for example, like West Lafayette and South Bend, which have major research universities that will be bringing people, thousands of people from around the country and around the globe together. That's a little different situation from some communities, significantly different from some. Bloomington is unusual in that virtually half of our population is student population. So that's an unusual aspect of our community that we're trying to identify. We're working closely with all the Big Ten communities. There's actually a meeting on July 10th of kind of the Big Ten city managers, mayors, and university leadership to explore some of these same issues. And again, when we see, in a way, this is kind of random. Where a surge will happen can depend on so many factors. But when we see what we've seen in Texas or in Florida or Iowa City or Madison, and we all can continue to follow the news, it just cautions us to really think carefully about what are some of the steps we might take locally that may not be terribly costly right now. Some of the steps that may be relatively simple to do that measurably bring down the chance that we'll have that kind of resurgence. So we're really in a lot of close touch with folks, including the governor's office and the health department. I know IU's doing that as well in the health department. And, this is a very uncertain situation. It has been since the pandemic was declared. And we all just need to keep listening, keep reading, keep watching what's going on and being ready to act quickly. We're not out of the woods.
And again, we'll take any questions. We do have media on here, so I know you're there, but happy to take your questions. But I'll ask a couple more as long as we've got a little time here. Kirk, I want to come back to you. A lot of the things that we're asked at IU is about just exactly what Mayor Hamilton alluded to, working with other institutions and thinking about what they're doing. That's something that IU has been doing from the start of this, is really coordinating ideas as much as anything with other institutions, Big Ten and otherwise.
Well, that's what you find in this business. There's no sense reinventing the wheel. And when you have university faculty and staff who are experienced in working with our communities, if one university or community comes up with a good idea, we always share it. And there's plenty of good sharing, and people are proud of the fact that others adopt their ideas. And we'll continue along that path because that's the best way to approach this. As the mayor said, our community is a little different because of the high percentage of our population that's student-based, but the solutions are a lot the same. And as I think the mayor may have mentioned earlier, we did notice that a good example of when people aren't acting responsibly, the community has to respond. And the county health department up in Madison, Wisconsin, has had to put the limitations back in place. And so my opinion is, even though we may need to restrict business when it comes to large indoor gatherings like bars and some restaurants, if we don't act responsibly there will be no business. So some business is better than none. And that's where we need to be. And we're going to continue to work with the business community, with local leadership and the university leadership to come up with the best ways, and include our students in studying this as well. In fact, we're working right now to put a group together that can brainstorm the best ways to do that. And I think that good collaboration that we have here in Bloomington, Monroe County, and with the university will pay off during this time.
Okay, we do have a question from Ethan Burks, WFIU, WTIU. This is for Penny Caudle. How would Monroe County go about walking back restrictions if there was a troubling increase of cases? Would the Indiana State Department of Health have to sign off on that?
Thanks, Ethan. We would not necessarily have to have the state sign off on it. The authority in the Indiana Code gives the health officer local authorities in outbreaks and these types of situations. So the health officer does have quite a bit of authority to look at what's going on. Now, we would have to look at what is being done from the governor's office as well, because those things have to sort of match up. And depending on what the governor's orders say and what they may or may not restrict, could affect what our local orders could be. So how we might move something back, what's different, those are decisions that would have to be made at that time based on the larger picture. And certainly, you know, when we look at gatherings, we've had a lot of people asking us about things in the future, you know, what happens about a festival or a party or a big event that's in August or September or late July. And, you know, there's a lot of planning, and for everyone who's planning those events, I feel very sorry for them, because the first thing is always, you have to be ready. You've got to have plan B. You've got to be ready to, if you're going to put the work into planning that event, you also have to be ready to cancel that event or to change it and scale it back.
Okay. This is also from Ethan for Mayor Hamilton. Can you talk about the thought process that went into canceling Bloomington's 4th of July festivities, specifically the parade and fireworks show?
Sure, and those were actually two different decisions. Like any big event like that, we had to make a decision about the parade, which the Parks Department organizes a couple months ago, actually quite a few weeks ago. And I know the sponsors of the fireworks show, which is not directly, it's a partnership with the city, and Cook Group has been a sponsor of that, was made also several weeks ago. And I think it was basically just looking at the logistics of large gatherings like that, the uncertainty of the safety of it. And I think probably prudently decided at that time, it didn't make sense to go forward with those. I do think, you know, the infamous story of the Philadelphia parade from the flu of 1919, I think does weigh on some of us, remembering that large outdoor events can really cause a problem. Though I think also it's relevant that we have learned that outdoor events are relatively significantly safer than indoor events if they're masked. But those kind of parades where everybody's crowded together for a period of hours can be very difficult. So that's what went into it. And I think it was the right decision at that time, and it's probably going to help us avoid other problems. And I'll just add to the previous question, you know, I want to appreciate the governor's, which is not uniform around the country, our governor allowing local jurisdictions to take a tailored approach, and also thank our local health officials, Ms. Cottle, Dr. Sharp, and others who have absolutely done that and tried to do the looking locally. And that is an important factor that lets us tailor to what we think we need here in Monroe County and Bloomington.
Question from Emily Ernsberger from the HT to Penny. Earlier, you mentioned about mandating certain practices in the future. What would that look like?
Well, Emily, it could be any number of things and will depend on the situation. But the one thing I think that's being talked about most right now, you've heard it already today, is the face coverings and the potential for mandating those, whether it's in certain situations or at a certain point. So again, we would prefer, and this has been our take all along, that we want people to do the right thing. And as data continues to come in, we know that wearing those face coverings is more and more important. And if we get to a point where, and I don't mean crisis point, right? Because we are watching the information constantly. But if we reach a point where we feel like that's the thing that we need to do, then we're not unwilling to do that. We would prefer to not have to make mandates, right? We would prefer that people do the right thing on their own and take personal responsibility so that that doesn't have to happen. Another example is when we moved into the current stage, we added, when the governor opened up bars and bar seating, that bar top service, we added another element of that because we were concerned about people sitting at bars for a long period of time and the potential to contaminate the items that were being used to, you know, the glassware and the garnishes and those kinds of things. So we added a mandate about that. And so depending on what's going on and what the situations are, we could determine that there are some other mandates that make sense and would reduce the spread of infection potentially. And it could be, certainly it could be that there's a limit. Maybe we don't go to 100%, we stay at 50 or 75%, or we scale it back slightly depending on what's going on. All of those things are part of the ongoing discussions.
If I can just add too, besides the masking, and Ms. Cottle referred to the question of bars and gatherings, and Kirk White did as well. It continues to seem that evidence around the country suggests that these gatherings of people that are indoors and that last a while and that don't involve social distancing are real spreader potential events. It's important to remind people that even under stage 4, the current Indiana guidance for bars is to allow 50% population in the bar, but they are still supposed to be socially distanced within the bars. Enforcement of that is very difficult. From my own observations informally, I don't think we're seeing that in some, at least some places. And so, for example, up in Madison, they imposed a rule that said those bars that are open have to be seating only, basically like a restaurant, which obviously changes the business, but it also is a way to limit the intense gathering of large numbers of people, half of whom would not know they're sick if they are sick. And so those are the kind of things that we may need to look at from my perspective, encourage the look at to see what we can learn from around the country to avoid the threat. Thanks.
Okay. One last question from Dave Askins, the B Square Beacon. The data on nursing homes from Centers for Medicare and Medicaid Services has some accuracy issues, but based on that data and based on some indirect information from one of the nursing homes in town, it looks like as many as 25 out of the 28 reported deaths in Monroe County might have come in nursing homes. That would help account for the 12.7% health rate, ration of deaths to positive cases in Monroe County compared to 5.5% statewide. Question, is there anything the public health department can do or say to our local nursing home providers to encourage them to share their information publicly so we can understand what's going on in our own community?
Thanks, Dave. We are in contact with our nursing homes, and I know that the state health department has been in contact with area nursing homes. They've been in contact with them across the state, whether they're offering strike teams to assist with testing, or whether they are helping them with assessments in terms of what they're doing. We have reached out to nursing homes to encourage them to share their stories, because I believe most of them are they are dealing with a high-risk population, and they are really doing a very good job. So I would encourage them all to tell their story, whether it's a challenge or whether it's a story of recovery or whatever it might be. And we have reached out to them and encouraged them to do that. You are right that the data system is difficult. And I'm hopeful, I said this on the noon edition, I'm hopeful that something positive that could come out of this pandemic for us is a better connection of resources and data, so that we can provide information in a more timely manner that we feel is accurate and that matches across systems. So hopefully that will come in the future.
Yeah, Mayor Hamilton.
Chuck, if I may just add, and this is an issue that it's a real concern to me, but let me make clear, there are two groups of people who are not doing anything wrong here and are the heroes. One is all the people who are caring for people in long-term care facilities and running those facilities and doing the level best they can, and they're heroes in protecting the health in all the ways that they can. And the second is our local health system, which is working like crazy too to help provide tools and to help give information and to share and to encourage, as Ms. Cottle indicated. Those two groups are doing all they can. I think but I do believe this is a real failure of the state health system and the decisions made at the policy level, because we absolutely ought to share this information with the public. There is no reason, in my view, that the public should not know if 2 deaths happen from residents at a particular nursing home, or 16 cases were determined at a particular long-term care facility, one, we ought to have consistency so that that information flows through a state that can verify the information, not just depend upon a facility to report it directly to consumers. But two, it's absolutely important for the public to know those things. I've had 2 family members in long-term care facilities in the last few months. We get some information, and again, it's not their fault, but it's really a failure, I believe, at the state policy level. And I'm not exactly sure why, but this information is important. It's shared in a lot of states, and it's kind of frustrating that we can't get that good information that's there out to the public. I'll stop with that.
Okay. All right. Well, we will pause it there. But one important note about next week, we will be doing this news conference on Thursday, the 2nd, from 1:15 to 2 p.m. So set your VCRs accordingly. So again, Thursday, the 2nd, from 1:15 to 2 p.m. The 3rd is officially a holiday, I know, for the city and for IU. So many of you may be out on Friday as well. But we will see you then and answer your questions that time. To everybody, thanks again for your time.
Thanks, Chuck. Thank you,
Thank you,
everybody.
Chuck. Appreciate it.
Thank you. Be well.